What's your legacy in neurosurgery? What do you really want to be known for in neurosurgery?
To be known for somebody who worked with many different disciplines and helped form teams that involved neurosurgery, neurologists, psychiatrists, neuroradiologists, and neuroscientists that together worked to tackle big public health problems and to be able to make an impact in helping treat conditions that did not have a solution for. We can continue on that if you want.
Yeah, we can talk a little bit more.
Yeah.
Talk a little bit more about what do you want to be known for the last 5 years in neurosurgery in terms of what are you doing innovation-wise?
Some of the areas that I think have been very important is for the neurosurgeon to be seen as the director of these multidisciplinary neuroscience institutes. So there's a lot of emerging aspects of neurosciences, these comprehensive neuroscience institutes that includes neurosurgery and neurology and psychiatry and neuroradiology and rehabilitation and basic neuroscience. So I think it's very important for neurosurgeons to have strong leadership positions in these areas. And to really, one of the key aspects that I think is important is to build multidisciplinary teams that are managing complex neurological conditions, like for movement disorders or psychiatric conditions or people with spinal cord or severe brain injuries. And the neurosurgeons need to really be a key central member of the team that is sort of helping coordinating all these different disciplines and working together, because in this day and age moving forward, it's really team efforts and team science that allows us to make discoveries. So neurosurgeons need to really be working with multiple other disciplines to make an impact. And I think one of the key areas for me has been helping the neurosurgeons be involved in the creation and development of these comprehensive multidisciplinary neuroscience institutes and multidisciplinary programs.
You've had a very long experience and history as a neurosurgeon, coming through many different programs. Talk a little bit about your path to get to where you are now as a leading neurosurgeon in this country and in the world.
I've been very fortunate to work with key mentors in neurosurgery in my career. So my interest in neuroscience and neurosurgery really stemmed from learning about the brain when I was an undergraduate at UCLA, and understanding that there's so much yet to be discovered about the brain. And then I was very fortunate to be exposed to key innovators in neurosurgery, key leading figures, Dr. Apuzzo, Dr. Weiss Gionata, when I was a medical student at the University of Southern California. At that time, University of Southern California was a major program for neurosurgery, so I was able to be exposed to the leaders there. And then when I went to residency at New York University, Dr. Joe Ranselhoff, Fred Epstein, Paul Cooper, and Pat Kelly, and all of them influenced me in a different way in terms of how you think about neurosurgical problems, neuroscience, and how you manage life as a neurosurgeon and the complexities of being a neurosurgeon. And also, I also was fortunate to work with key neuroscience innovators like Rodolfo Linus and New York University and others that allow me to have a understanding of the fundamental, the basic aspects of neuroscience, the looking at imaging and looking at animal studies and physiological tissue culture and other studies. And then my fellowship really further focused it all, working with Andres Lozano and Ron Tasker and other leaders. And really, I've been very fortunate to be exposed to the giants in the field, and that really helped shape my path in neurosurgery. And also, I've been fortunate when being involved when new technologies came about. So when I started, deep brain stimulation was just starting worldwide. Professor Benabid, one of my mentors, and then Dr. Tasker and Lozano. So I was very fortunate to early on being involved in the participation and the development of these new technologies that were being developed using deep brain stimulation, and then working with colleagues like Pete Konard and others, looking at brain-computer interface and deep brain stimulation, and really integrating physiology, anatomy, neurology together, and collaborating with companies. And that's an important element, collaborating with companies, developing neurostimulators to really make an impact. And I think that was some of the most exciting times in my career when DBS was just starting, and now ultrasound is just starting, neuromodulation. So it was really the combination, the amalgam of technologies, industry, new technologies, and mentors that really shaped the future of functional neurosurgery. Working with individuals like yourself, who has been a leader in the field of functional neurosurgery, mentors that have taught me about aspects of neurology and neurosurgery and psychiatry. And I think as a functional neurosurgeon, it's very important to work with multiple disciplines. But also working closely with companies and the industry is really important, because as they develop technologies for deep brain stimulation or spinal cord stimulation or focused ultrasound, you need to be an early adopter of these technologies and embrace them and make them a standard part of the practice of patient care. So combination of visionary leaders and mentors, tremendous colleagues in multiple disciplines and companies, and also fundamentally the most important thing is the need for patients. That's what really drives us, is the patients with disabilities and the opportunity for neurosurgeons to help improve quality of life and functioning in individuals. And that's what I think really underpins the entire aspect of functional neurosurgery.
Can you talk a little bit about how important it was for you to get involved in organized neurosurgery? Why did you feel that was a path that either attracted you or was needed for you to go into?
Organized neurosurgery was a very important aspect of my career, and having the opportunity to serve and as a volunteer and be mentored by others who are involved in organized neurosurgery, learning about participation in different committees, in the scientific program for the meetings, or advocacy, or education. So organized neurosurgery provided a phenomenal opportunity for me as a young neurosurgeon to start getting to know others in different institutions, learning from them. And it was really helping for advocacy from the Washington Committee for Neurosurgery, as well as education aspects, training the next generation of neurosurgeons, and being involved in research and education. So organized neurosurgery provides a tremendous opportunity for you as an individual to get exposed to so many different individuals in our field and broadly beyond, with neurologists and others. And it's a great opportunity for somebody to really grow and understand how the different elements of neurosurgery together contribute to the advancement of our field. So that was a very unique part of my career. For 12 years, I was in the board of the Congress of Neurosurgeons and other organized neurosurgery, American Society of Stereotactic and Functional Neurosurgery, and the friendships and the bonds that you made with so many people over the years has really been cultivated. And you and I met in the societies. So I think it's important to meet others, learn from them, exchange ideas, and to really together advance education and training, advance clinical trial standards, that what we do, and also research and innovation that leads to the future discoveries and hopefully cures for some of these conditions.
Did being president of those organizations give you something that helped you with your career later?
I've been fortunate to be the president of some of the societies like the Congress of Neurosurgeons, and that really gave me an understanding of the structure, the different groups that you have to work together, compromise, making consensus, building consensus, and also being able to understand the many different aspects of neurosurgery. So working with spine neurosurgeons and community neurosurgeons and brain tumors and pediatrics and vascular and functional neurosurgeons, and a whole range of people with different backgrounds, from academic or non-academic. So it really allows you a great opportunity to work with the entire community of neurosurgeons, and each and every one of them. It's important in terms of what's important for their practice, for their education, for their continuing medical education, and also elements that are involved in advocacy. And so you really have to, it was a great opportunity to learn about what's important for each facet of neurosurgery, and work in an organized fashion with so many individuals to really try to make an impact. And I think fundamentally starts with education for all of us.
Again, just having you think through the top 1 or 2 or 3 things as you're sitting here reflecting on maybe 25 years or more of practicing neurosurgery as an attending, what today really, maybe in the top one or two items, motivates you to walk in and do what you do every day?
I think it's all about patients and their needs. So that's why we're here. So when you see people that have neurological or other conditions that there's not much hope for them, or they don't have a cure or a good effective treatment, I think that's the biggest driver for me and the teams that I've been involved with. And I think one of the key things for my career has been being part of teams that have the same purpose and passion to make a difference. And in my career, I've been at New York University, the Cleveland Clinic, Ohio State University, and West Virginia University after my fellowships. And each institution, it's been a wonderful opportunity to help build teams together, be part of multiple disciplines. And in my career at Cleveland Clinic, we were really active in helping